Good morning. I'm going to do a nasotracheal sectioning. So the first thing I'm going to do is check the patient's charts and obtain any important information that I may need, and then also gather all the necessities of the PPE like a gown, face shield, and the suction catheter kit. So when I'm ready, I knocked on the door, introduce myself, wash my hands, check the patient's ID band, and then I'm going to make sure I always apply the appropriate PPE before assisting the patient. And then I'm going to listen to the patient's lung sounds, and then I'm also going to check the vital signs before I begin. And I'm going to get everything prepared for the treatment. So I'm going ahead and set up my regulator here, the vacuum, and I'm going to get it ready. So what I'm going to do is I'm going to glue the end piece to make sure it doesn't go above -150, and if it does, we can lower it down and recheck to make sure it stays in between -120 and -150. So when it's ready, then we can just set it off here to the side. Make sure nothing falls and doesn't touch the floor. And then always you want to hyperinflate the patient's lungs. So you can apply the oxygen source before the nasal trumpet if you have one. But if you have a nasal trumpet, you can go ahead and measure it. So you would always bring with you a couple of them, different sizes, just in case if you don't have the right size with you. And so what you're going to do is you're going to measure it from the ear to the nasal opening here. And when you find the right size, you want to make sure with the nasal trumpet, you don't want to have too big of opening. You want to kind of match with this, make sure it's not too small but just right for the patient. So when you're ready, you would lubricate the end piece of this, and then you would place it in. Always place the bevel towards the nasal septum, but if you can't get on that side, you can go on the other side, but you just have to be careful, and then you'll have to kind of twist it when you get down. But since this side is clear and everything looks okay in the nose, then I can place it in. And then I would grab my oxygen mask for the patient and attach it to my oxygen source, set it at the appropriate flow to make sure this bag inflates. Once the bag's inflated, then you can place it onto the patient. That way it hyperinflates the patient's lungs. So then I will get my kit ready. I have my sterile gloves here. I want to make sure these are open so that way I can just place them on. I'll get my lubricating jelly ready. I'll place it on the lid, or you can place it on clean gauze. And then I'm going to place my sterile water into the basin here to cover and re-sterilize the catheter. And then once I'm ready for that, then I can grab my tubing. Always make sure the tubing is not kinked. Patient, and if the doctor needs a sample, you can always attach an extra piece here to grab the sample when you do the suctioning. But before you do anything with the grabbing that, you want to have this ready to go, but you want to make sure you have the sterile gloves on beforehand. So with these gloves, you can remove them, or you can leave them on and place the sterile gloves over top. So when I'm ready, you always want to make sure your dominant hand is your sterile hand. So I'm going to apply my sterile gloving. And sometimes, like especially if your hands are a little bigger, sometimes it is hard to get those sterile gloves over top the other gloves. Alright, so once you're ready, now you can grab the tubing with your left hand, and then you would grab with your sterile hand the catheter. So when you know you have it placed on properly, you'll hear a hissing sound. And what you'll do is you'll take the end piece very carefully and you'll suction up some sterile water to make sure it's working properly, and also then it can kind of lubricate the inside of the tubing to help the secretions. So when you go, you want to lubricate the end piece so that way it goes in nicely to the patient and it doesn't harm the patient. So when you're ready, you will remove the oxygen source, and then you'll slowly, carefully go into the patient's nose. then if you feel an obstruction, you can have the patient cough if they're able to. And then you go in and you would section. You don't want to section more than 15 seconds. So when you're done, you would slowly move up the suction catheter to make sure you don't splash anything. Sometimes you can place something over the patient. That way if it does splash, then it'll get on the sheet that you can dispose of. And so if you want to do it multiple attempts, multiple times to suction, you can only do it up to 3 times. You don't want to do any more than that because you don't want to cause any complications for the patient's lungs. So you want to, when you're removing, you want to wrap it around like this. Remove the suction catheter. Then you can remove it with your gloving like this. Oops, not to drop it. And then you would place it off to the side. Try not to touch anything, but if you do, then you just dispose of it and get to new tubing for it. You would remove your PPE, wash your hands, apply gloving, and then you would reassess the patient, listen to the patient's lung sounds, see if the oxygen source is getting above back to where they need to be, check the vital signs. If they are finished, you can always shut off the regulator vacuum here, and then shut off the oxygen source if they're back to normal. Place it into the appropriate area, and then when everything's done, check the patient, and you can remove all the stuff, remove your PPE before you leave the room. Wash your hands, then I would go and check the patient's chart, and then let the doctor know what I did for the patient.